What is a pacemaker? Electrical activity within the heart determines heart rate. If this electrical activity is delayed, a slow heart rhythm may occur. People who have slow heart rhythm may feel tired, dizzy, or lightheaded, or even pass out. Pacemaker is a small medical device that is placed under the skin below the collarbone and is used to treat symptoms related to slow heart rate. A pacemaker is composed for two parts, a push generator and a wire lead. The lead is passed through a vein and make contact with the heart muscle. The push generator constantly monitors the heart rate. Detect that a heart rate falls below a certain level, it sends an impulse down the lead to the heart, which causes it to beat. So, how is pacemaker implanted? A small surgery is required to implant a pacemaker, which takes about 9 hours. Patients are awake during the procedure and are given a mild sedative. The area under the collarbone is frozen and a small incision is made. The lead is then paid through the vein to the right side of the heart using X-ray guidance. The push generator is then connected to the lead. Incision is closed. The patient will usually go home for the next day. Is pacemaker surgery safe? Pacemaker surgery is safe. The most common risks are bruising, bleeding, or pain around the surgery. Other risks include infection or pacemaker lead moving, requiring another procedure to reposition it. What will be happen after my pacemaker surgery? After your operation, you will be given instruction on how to care on your incision and will be given an appointment to come back for the pacemaker clinic in a few days. You may not drive for 1 week and should not lift up your arm into 1 month. If you have any questions, speak to your doctor or call the pacemaker clinic. Your heart has its own natural pacemaker called the sinus node. It sends out regular electrical impulse that cause the chamber of your heart to contract and produce a heartbeat. If your sinus node does not work properly because of a heart condition, your doctor might recommend a pacemaker, a small implanted device that sends electrical impulse to keep your heartbeat regular. Impulse does not shock the heart, they simply do not the job. The sinus node, some pacemaker only function when they are needed. This generates off all the time. Our research transformed the old bulky pacemaker design into a small, sophisticated device that is the size of the small matchbox and weight about the same as 2 AA battery. He is about to get a pacemaker fitted and is understandably nervous about the whole thing. She's given a local anesthetic, so is awake during the procedure and notice some mild discomfort, but feel relaxed. It's around an hour. His pacemaker is inserted under the collarbone and leaves are placed into a heart through a vein. After being reviewed by a doctor, Julie is able to go home for the same day. The first 6 weeks after having the pacemaker fitted, Julie has to take extra care for the arm and shoulder. Julie is not able to drive for a little while after getting it fitted and has to let the car ensure that she had a pacemaker at regular clinical appointment. Her doctor made any tweaks necessary as a pacemaker store information about her heart rhythm. Notice some twitching when a pacemaker first sends electrical impulse, so she tells her pacemaker clinic, and they are able to change the setting to stop this. She has to be aware that magnet can interfere with the pacemaker, so she needs to make sure that she keeps any electronic device like her mobile phone in a pocket away from her heart pacemaker. Julie also has to stay away from induction hoops and avoid travel letters and grills. It is very rarely cause problem. Julie shows her pacemaker ID card to the staff before she goes through airport security. She carries her ID card with her at all times in case of emergency. Thanks to a pacemaker,